Thank you. So my name is Karno. I'm a professor at California State University, San Marcos. I'm from the Department of Chemistry. My topic is the evaluation of potential application of a portable and wireless spectrometer in the medical and forensic field. So here's the outline. So I will first talk about the portable wireless spectrometer, and we'll evaluate the function of it with a commercial dye. And then we'll compare the performance with the benchtop traditional UV vis instrument. Then I will introduce the color test for a commonly abused drug, street drug. Its chemical name is GHB. And then we'll get into the most important part of this talk, which is try to see if the portable wireless spectrometer will have the potential to detect this drug quantitatively, meaning finding how much it is. So the first part of the talk will be just introducing this, try to evaluate how the performance of this wireless device. So here is the picture of it. So this is as you can see here, this is the spectrometer. It's wireless. It can be connected through Wi-Fi with the smartphone, iPad, or computer, and you can download the free apps from the Android or the Apple Play Store. And then it scans the range in the visible region. Here I just have a galaxy tab, and then I just have the portable desktop tab, and then I have the keyboard. So first I evaluate the performance of this commercial spectrometer. So I use a dye, purple dye, vegetable dye. The reason why I use purple is because later on when I talk about the color test for the abused drug, the color that we will produce is purple, and that's why I use purple dye here. So from the purple dye, I do a 1:80 dilution, and then I arbitrarily call that concentration to be 1 unit, and then I do a further dilution to get a standard solution with a arbitrary unit of 0.75. So this is the one that I used to make the measurement, finding the maximum wavelength that it will absorb. So the cuvette that we are using to hold the sample is with a path length of 1 centimeter, and we scan it from 400 nanometer to 700 nanometer and try to find at what wavelength it will give the maximum absorbance. And here is the spectrum. As you can see here, the maximum wavelength, the wavelength that gives the maximum absorbance is 541.1 nanometer. So then we try to see if this wireless spectrometer will give us a good linear relationship as we change the concentration of the dye. So I use from the 0.75 arbitrary concentration, we create more diluted standard solutions. As you can see, here's the unit. And when we do the measurement, we use besides using the 1 centimeter cuvette, we also use a smaller cuvette with a path length of 0.2. The reason we use a smaller path length is because ultimately we want to see if we can apply this for detection of the drug, and then usually with the samples, for example, we can get the urine sample or the blood sample from the patients, and that is very limited. So if we can use smaller sample, that's preferable. That's why we try to test if we can use the smaller cuvette with the path length of 0.2. So here's the calibration curve. So when we're plotting the concentration versus the absorbance, as you can see, it has pretty linearity, it's pretty good. The R square is 0.9894. Just to let you know, if it's a perfect linear relationship, the linear regression, the R square value would be 1.0. So this is very close. So if we use a smaller cuvette, the path length is 0.2 centimeter, the linear regression is also very good. So it shows that both path length of 1 centimeter and 0.2 centimeter is giving us a very good linear relationship. Next, we try to find the beam height of this instrument, of this wireless spectrometer. So we try to fill the cuvette with full, which is about 44.92 milliliter. The volume is 4,120 microliter. And we compare the absorbance measurement with, if we fill it with half height with the purple dye. As you can see here, the absorbance is exactly the same. So that means that the beam height is at the half height because we don't need to fill the cuvette all the way to the top. So just for, you know, just to provide flexibility in case that we want to do a 2-layer system. So let me show you the diagram here. So let's say the top part is color and then the bottom part is not. And the way we recreate this is using a aqueous layer for the top, which is the color, the dye that we are talking about. And then we have an organic layer at the bottom, and the one that we use is methylene chloride. And we determined that for if we fill the cuvette as the half height, which is the 2,340 microliter, the height of the purple color, the maximum that we can get for the absorbance signal is we will have a height of 5 milliliter with a volume of 540 microliter, and the rest will be the organic layer. So this just the reason to do this is just in case, later on, if to provide flexibility, if there's some system, some color test that involves 2-layer, then it can be applied to it. So then we compared our performance with this wireless spectrometer with the traditional benchtop UV-Vis instrument. So during the comparison, we are preparing a new set of standard. So from the dye, we take 5 ml and dilute into 10 ml. Basically, it's a 1:2 dilution. Then we do a 1:50 dilution. That means this final solution is 50 times less concentrated than this one. And we arbitrarily give it we call this the stock solution. And we arbitrarily call the concentration to be 2 units. And then we do from there, we prepare 5 standard, 1.6, 1.2, 1.0, 0.8, 0.5, and 0.25. Then we measure the absorbance signal at 542 nanometer, which we determined in the previous study that you see in the previous slide. And here is the calibration curve. The one in the red is the benchtop traditional UV instrument. The one in the blue is the wireless spectrometer, the portable one. As you can see, is very compatible. So from this study, we are convinced that the wireless portable spectrometer performance is compatible with the traditional benchtop. So knowing this, so we have the confidence to try to see if we can do the test for the abused drug. Right, so here's the conclusions of what we are talking about. The only new point here is that we try to test how far the wireless portable spectrometer can connect it to the device, like either your phone or the computer, and we tested the maximum is 60 feet. So now we are ready to test if the portable device can be used for the detection of the abused drug. So most of the on-site detections is just telling you if the drug is appear on it or not. Like it's a color test. It's just like your the pregnancy test or the COVID test, right? You put your sample in there, and then it will, with a color strip, it will tell you yes, presence or not presence. But what we are proposing is to see if we can not just telling you if the drug is present, but how much it is by using this portable device. So our hope is, if you can do it on site when you're during the transportation to the hospital, the patients, then you will have some preliminary result before you get to the hospital. As you know, when the patients get to the hospital, it takes time for the lab to get the lab result. So we're hoping that we can get the on-site preliminary quantitative analysis of the on drug overdose cases. So the drug that we are trying to detect as a demonstration is the GHB gamma hydroxybutyrate. Okay, and here is the structure. It is a Schedule 1 controlled substance. It is usually white, colorless, white powder, or if it's in a solution, it is colorless. It tastes a little bit salty. It is also, this drug is also used in a prescription drug with a brand name Xyrem. Okay, it's being used to treat the cataplexy, which is a condition that you will have a sudden loss of the muscle tone, or you also treat for excessive daylight sleepiness in the patient that suffer in narcolepsy. Okay, so GHB is a common street drugs with the name called liquid X or liquid ecstasy, or goop, soap, or scoop. It's abused by most of the teenagers or young adults when they do the rave parties. Okay, and sometimes they mix it with the alcohol to intensify its effect. The onset action when you take it all by mouth is about 15 to 30 seconds, and its effect can last from 3 to 6 hours. So here is the colorimetric test that a paper that I published way back in 2002. So the GHB, this drug, once you acidify it, it will be converted to a lactones, and then once you further react it, it will open the ring will open up to give you the hydroxymate acid, and then it will form a complex with the iron to give you this colored, purple colored complex. And this is the colored test that we are aiming for to detect the GHB, because the GHB is colorless. So we have to modify this colored test, because we want, the one that we're proposing is we try to perform this color test doing all these reactions. I put the reaction again on the right-hand side of this slide. In the cuvette, in the spot, we develop this color in the cuvette of the instrument so that we can immediately detect the absorbance. So this is the adjusted procedures, because we need to make sure that all the reagents can fit into the volume of that cuvette, which is only holding 4 milliliter. So here is the adjusted procedure. We only add 0.3 ml of the standard solution of the GHB, which is 1 milligram per ml, into the cuvette. Then we add 0.5 ml of the 3 molar sulfuric acid, and this step to get it to the GBL. Then we add 1 ml of the 0.5 molar hydroxyaluminum chloride here, and then we also adjust the pH to 10 by adding 1.26 ml of the 3 molar sodium hydroxide. And by the way, we use a pH paper to measure to make sure that the pH is 10. Then the ring open up to this acid. Then finally, the final step is we add we acidify it by adding 0.2 ml of the 3 molar sulfuric acid. Then we add the iron chloride to develop this color. Once this color is developed, we are using the spectrum to scan it to measure the maximum wavelength. Okay, and we found that it is at 500 nanometer. So just to test it, we try to see if this method of developing the color, carrying out all this reaction, this 6 steps of reaction in the cuvette, and develop and then detect it immediately to find the absorbance. Before we take it to the wireless spectrometer, we try to detect it with the benchtop traditional UV instruments. So we prepare 5 standard, and then we carry out the color test. And we do the calibration curve, and we do it 3 different times, and just to test, how precise our measurement is, so repeatable from day to day. As you can see here, we compare the R-squared value from the 3 calibration curve, and then the RSD, the relative standard deviation, is reasonable, is 5.94%. So it shows that it is repeatable. Then next, we're comparing the performance with the wireless portable UV, the wireless portable spectrometer. The blue line is the benchtop. The red one is the wireless portable device. As you can see, the R-squared value is compatible. So so this preliminary data shows that it is possible that we can carry out the this colored test on inside the cuvette and detect the absorbance directly, immediately with the wireless spectrometer. So that's all and then I want to say thank you to my 2 students, Mike Dai and Maria Vidaca, and also the grant that we got from California State University I-Corps program. So thank you, everyone.